Gallagher. I'm the President and Chief Executive Officer of Phi Gamma, Sigma's only virtual chapter, and your host for this evening's presentation. Please join me in welcoming Dr. Marilyn Klakovich, Chair of the Education Committee for Omicron Delta Chapter from the University of Phoenix in Phoenix, Arizona, USA, who will share information regarding continuing education requirements and introduce the event's sponsors. Dr. Klakovich?
Thank you. I'm pleased to disclose that there are no conflicts of interest that have been identified in relationship to this educational activity, and no commercial support was received for our program. Our sponsors do not endorse any products that may be discussed in this educational program. If you want to receive continuing education credit, you do need to attend the entire session and complete an evaluation form. And you'll learn more about that at the end of the webinar. If you do have any questions or concerns about your continuing education, you can contact me. My email is listed here. It's mklakovich@apu.edu. Our sponsors this evening are Phi Gamma Chapter of Sigma, Our Lady of Fatima University, Omicron Delta Chapter of Sigma, and Nu Psi at Large Chapter of Sigma.
Dr. Berman, would you tell us a little bit about Nu Psi at Large Chapter, please?
Thank you very much. And we are at Nu Psi at Large Chapter very happy to be joining this collaborative and participate in the sponsorship of these educational opportunities. Nu Psi at Large Chapter, it consists of 3 universities: California State University East Bay, that has 2 chapters, one in Hayward and one in Concord, California. We're all in California. Holy Names University, located in Oakland, California, and Samuel Merritt University, the home campus in Oakland, California, and 3 additional locations for campuses are in Sacramento, San Mateo, and Fresno. As you can see, we've been around for a while, chartered in 1993, and have over 650 active members. We have received a number of key chapter key awards, pretty much every biennium, and a Region 1 Excellence Award and an Outstanding Newsletter Award. We're very proud of our newsletter. Ongoing service activities, just like other chapters, I'm sure have been a bit of a challenge in 2020. We continue to do April showers, which has to do with collecting toiletries for the homeless. And in lieu of sponsoring our medical missions this year, we have decided to be both local and global and donate to a number of organizations, anything from the homeless to Clear Fresh Water and the Greta Foundation, for those of you who are familiar with that organization. And so primarily after we went into lockdown, we have not offered any additional educational conferences other than these, but on the slide you can see a couple that we've done in the past. So we are very excited to be participating in these sessions.
Dr. Klakovich, will you be presenting on behalf of Omicron Delta?
Yes, I will. Our president, Lisa Radici, was unable to be with us this evening. So as a past president of the chapter, I'm representing her. We were chartered in 1998 and we have over 2,000 active members. And we have also received chapter key awards for the past 7 biennium. We have also been recognized for regional excellence in Region 2. And we've received a couple of international awards, the Dean Award and the New Member Pillar Award. We have several ongoing service activities. We make blankets for Project Linus. We collect medicine bottles to be used in disadvantaged countries where they need to safely distribute medication. And we also raise funds for water.org as part of our H2 Omicron Delta initiative. We do have an education conference coming up, and it's a fall virtual conference on November 7th. And our keynote speaker happens to be with us tonight, Sigma President Richard Ricciardi. So we're really looking forward to that event.
Thank you very much, Dr. Gallagher, and a pleasant day to everyone. Our Lady of Fatima University is an autonomous higher education institution in the Philippines known for its allied medical sciences programs, including undergraduate, graduate, and postgraduate degrees. It was established in the 1967 by Jose Olivares and Dr. Vicente M. Santos Sr. OLFU currently has 6 campuses located in Valenzuela and Quezon City in Metro Manila, Antipolo City in Rizal, San Fernando City in Pampanga, Cabanatuan City in Nueva Ecija, and Santa Rosa City in Laguna, Philippines. Just recently, OLFU was recognized as a recipient of the prestigious Philippine Quality Award for Proficiency in Quality Management based from the Baldrige Award criteria in the US, the highest award given by the President of the Republic of the Philippines. OLFU, with its current president, honorary member, Dr. Caroline Marian Santos Enriquez, is being recognized worldwide, and just like the New York State Department Medical Group, and is a known producer of board top-notchers. The university operates under the values of truth and compassion and mission and vision of improving management.
Again, I'm Rita Munley Gallagher, the President and Chief Executive Officer of Phi Gamma, which has been a part of Sigma for over a decade. We have over 425 active members in more than 30 countries on 6 continents from all around the world, and our chapter leaders come from 11 countries. Since its chartering, Phi Gamma Chapter has been recognized by Sigma with a number of awards, including the Chapter Global Community Building Award for having excelled in fostering a global community of nurses. The chapter has earned 3 Chapter Key Awards and has also received recognition through the Showcase of Regional Excellence for Phi Gamma's efforts to fulfill all aspects of the 2 latest presidential calls to action. The chapter also engages in philanthropic activities, in part through its Pay It Forward for Founders Day campaign. The chapter raises funds through the Phi Gamma Wave Project, Water Access Virtually Insured, as a part of water.org. In addition, the chapter assists in shipping pediatric ambu bags to the Philippines through its Breath of Life initiative, and the chapter's Crib Crusade, Care and Restoration of Infants through Breastfeeding and Breast Milk Banking, collaborates with Baby Doo-Doo Docs, Advent Moms, Our Lady of Fatima University to ensure that preemies and infants with unique needs get the best start at life by supporting moms and babies in the Philippines. During this evening's session, the presenter will define authentic assessments, describe the various types of authentic assessments that can be used to determine the participant's performance, and evaluate how students can personally benefit from this type of assessment. It is now my privilege to introduce Dr. Maria Yulita S.J. Sibian, Phi Gamma Chapter Program Director, whose committee is responsible for this evening's presentation.
Good morning from the Philippines. We are blessed today for having with us one of a well-respected and proactive nurse in the United States. She's an associate professor in the School of Nursing of George Washington University, located in Ashburn, Virginia. She holds a PhD degree in nursing at the George Mason University in Fairfax, Virginia, and Master of Science in Nursing in Marymount University, Arlington, Virginia, after she graduated from her bachelor degree from Radford University, also in Virginia. She also served as a director of programs from 2013 to 2016, director of faculty development, 2012 to 2013, American Association of Colleges in Nursing, AACN, Washington, D.C. Our speaker has wide experience in nursing practice and education, from a clinical nurse specialist at coronary care unit at the Sentara Norfolk General Hospital in Virginia, to being a clinical nurse educator and faculty at George Washington University. Truly, our speaker is an expert in the field of nursing education and assessment. She also served Uncle Sam by serving as an individual Ready Reserve U.S. Navy Reserves with a retired rank of captain, where she received a lot of military medals and decorations. She's a proactive member of various professional organizations and owner societies in nursing, including our beloved Sigma Theta Tau, and she holds 7 nursing certifications. She completed the ENFLA, okay? And ENFLA is the Experienced Nurse Faculty Leadership Academy offered by Sigma Theta Tau International, the only honor society of nursing. The program pairs full-time faculty who have at least 7 years of experience with experienced mentors who are then supported by ENFLA faculty members. Throughout the academy, scholars develop an individualized leadership progression plan and create and implement a leadership project to achieve their desired leadership development. As a researcher and academic, she has published a total of 19 research publications, 6 chapters in books, and 35 research presentations in local and global spaces. Due to her excellent service and dedication to nursing, she received numerous awards in the field of research. To name a few, she was recognized in 2008 winner of the Rear Admiral Mary F. Hall Award for Nursing Publication Research category. This award was established to encourage publication and to recognize Navy Nurse Corps officers who have contributed to the science of nursing. Topic: research considerations when studying disasters. She was also the recipient of the Honor Society of Nursing's Pinnacle Regional Award for a research dissertation. Per Sigma Theta Tau International, this award recognizes a nurse whose doctoral dissertation is exceptionally meritorious and exemplifies high standards of scholarship and knowledge development. The criteria for the award included having a dissertation with a study problem that was significant for the discipline of nursing, proceeded with a clearly defined conceptual or theoretical base, had methods, sample, data collection techniques, and data analysis that were valid and consistent with the research design, contained findings that contributed to the body of nursing knowledge and set the stage for a research career and the direction for a program research. Ladies and gentlemen, we are very truly grateful and indebted and thankful for a prolific yet humble global nurse champion. And please join me in welcoming my friend and colleague in the profession, Dr. Catherine Wilson Cox.
Hello, everyone, and thank you so much for that wonderful opening. I think you went through my CV, and so I'm pretty old because I've done a lot of things. So I just want to welcome everyone that's here today, and also I want to introduce you to my colleague. I don't have the full CV in front of me, like what was just demonstrated today for me through my colleague Margin there. But yes, we have a surprise for you today, and I would like to welcome my colleague from George GW Nursing, and it's Richard Ricciardi, who's president of Sigma Theta Tau International Honor Society of Nursing. Rick and I'm so proud of Rick. We're both veterans. I'm Navy, Rick is Army, so we can give each other a hard time about Navy beat Army, except Army has done really well for the last couple of years. Rick is on recall right now, so is dual-hatted for working at GW, but also for the Army, and then now as president of Sigma International. So we thought we would offer some opening remarks on behalf of Rick, and we're happy to say that he's actually with us tonight. So I would like to turn the floor over to Rick to present some remarks. and welcome you to the conference.
Thank you so much, Kathy. Can you hear me okay?
Very good.
Yes.
Okay, great. It's really a delight to be here with you tonight and to be invited to this wonderful conference. I'm so appreciative for that and, for all you do. So first, let me start by, on behalf of our terrific CEO, Dr. Liz Madigan, my partner, and the board of directors from Sigma, I bring you welcome. We are just so appreciative of all the leaders in Sigma. We know that Sigma could not possibly be the great international organization that it is without the tremendous efforts, dedication, and hard work of our members, our leaders, our chapter leaders, our counselors, our chapter counselors, everyone who participates in the family of Sigma globally to make Sigma the great organization that it is. We are in our 98th year now, and we will be cranking out or kicking off, if you will, the 100-year celebration at the biennium next year in 2021. We hope that we could have an in-person meeting. As you know, the Healthy Workforce meeting will likely be moved from in person to virtual meeting. Well, it will be moved to a virtual meeting. The next meeting after that, which is the research meeting in the summer, we have no idea whether that will go virtual. Right now, we're planning for that to be live, but with COVID, we have, COVID is controlling the environment right now. That said, before I pass it back over to my esteemed colleague, I would like for us to take a moment to think about all the nurses and healthcare professionals that are engaging at all levels, whether it's at policy levels or academic levels or clinical practice levels, that have given so much internationally to reduce the fatalities and the comorbidities that are associated with COVID-19. We know that nurses have been on the front lines of the COVID war. And we know that some have died. If you saw the ICN report, you saw how many nurses have died. We know other healthcare professionals have died, our colleagues. So let's just take a moment to think about that and thank them and to appreciate them for what they have done and how they have contributed to the world at this time. Thank you for that. And I would like to pass it and turn it over to our wonderful guest speaker tonight. And like I said, on behalf of our CEO, our board of directors, our members all over the world, I wish you all to be well, to be safe, strong, and capable as we continue this fight against COVID. We are going to win, when the only way we can do it is if we are together in this. And that's part of what we do as a professional organization. As you know, we've launched many new initiatives. We have the Find Your Forward page on the website, which has many wonderful opportunities to help us get through the COVID. And then of course, we have a launch page on COVID where we have many guest speakers and podcasts. So Sigma has shifted its efforts with COVID on the dime, if you will, to try to be responsive to our members' needs. So we hope that you do look at our website and you look at some of our programs that are dedicated to helping us to get through this crisis. So thank you all. I want to wish you a wonderful evening. And I now would like to reintroduce my friend and my colleague, Kathy, who will, I'm sure, put on a good show for us tonight. Thanks, Kathy.
Thank you, President Ricciardi. We really appreciate you taking time out of your busy schedule to be with us in our inaugural event this evening. And without further ado, Dr. Catherine Wilson-Cox.
Thank you. That's a hard act to follow. Thank you so much to my colleague, Dr. Richard Ricciardi, for being with us today. It's been a long day for you, so really appreciate it. Next slide, please, and welcome everybody. So we're going to spend a little bit of time this evening for those of us in the United States, and this morning for those of you in the Philippines, talking about authentic assessments. So when considering how to assess student learning in a course, most instructors would agree that the ideal assessment would be one that does not only assess students' learning, but it also teaches students and improves their skills and understanding of the course content. How do you do that? It's by using assessments that are authentic. Next slide, please. So authentic assessments require the application of what students have learned to a new situation, and that demands judgment to determine what information and skills are relevant and how they should be used. They can often focus on messy, complex, real-world situations and their accompanying constraints. Next slide, please. So how about authentic assessments in nursing education? I have to share that most of what I'm sharing with you today comes from the Poindexter et al. Article that's listed below on all of these slides, because Poindexter and colleagues have really framed and have put together a great article to talk about authentic assessments in nursing education. And it's all combined in that one article and is just very straightforward. So if you need a reference, and if you're wondering where this content comes from, it's from my colleagues, Poindexter et al. So authentic assessments in nursing education, we want to first define an educational assessment. So that's a collection of information about student learning and achievement. And we all have to agree that that's a critical part of an effective educational process. Nurse educators can use a wide range of methods, including what we're talking about today, authentic assessments, to assess competency and clinical performance benchmarks supporting student progression. The definition of authentic assessment, and this you can find in Poindexter's article, and it is an assessment requiring students to use the same competencies or a combination of knowledge, skills, and attitudes that they need to apply in the criterion situation in their professional life. Authentic assessments require that students be active participants in the learning and be able to demonstrate those KSAs, the knowledge, skills, and attitudes. The basic premise of authentic assessments is that you want to know how well someone plays tennis. Well, the best way to assess it is have that person play tennis, not take a multiple choice test about how you play tennis or how the scoring occurs. You actually watch them play tennis. So I thought that that was a great analogy for what we're trying to get at with authentic assessments. Next slide, please. So most of us know how traditional assessments work. That's what we do most of the time. They place greater emphasis on testing student acquisition of knowledge and concept, whereas authentic assessments, they test the transference of that knowledge and integration of these complex concepts. So tests aren't enough. Integrating more authentic assessment methods, those provide us a more comprehensive approach to support student learning that is useful beyond the classroom. Authentic assessments emphasize assisting students to develop the connections to make those important connections among the facts and apply new information within a variety of contexts. You know, we're trying to get to the critical thinking skills and the application in real world knowledge. The integration of authentic assessments is not meant to replace all traditional assessments. Go ahead, advance the slides, please. So if you refer to the article, if you go back to the article by Poindexter, they give you these a context and a framework for if you're thinking about developing authentic assessments. So they say there are 9 characteristics of authenticity, but they measure it by 3 categories. And those categories are context, Student role, because remember, we want students to have a part in this evaluation process as well. And then also, how are we going to score that? So with the context, they're looking at, is it a realistic activity or context? Is the task performance-based? Is a task cognitively complex? So if you're trying to decide if you're going to do an authentic assessment, that can help you with placing it into context. I'm sorry, I have a little background noise right now. For some reason, my dog has decided that she's going to eat her dinner right now. So stick with me. The student role, that's a defense of the answer or product is required. That the assessment is formative. You know, so formative is kind of free flowing. It's not summative. And so when we're looking at authentic assessments, we can ebb and flow with what we're testing for the students. And then the students are going to collaborate with each other. And they're also going to collaborate with you to get to their learning. Scoring. The scoring criteria, that needs to be transparent. So the scoring criteria are known, and they can even be student developed. You can have the students help work with you of what they think is important for them as far as a scoring. Multiple indicators or portfolios can be used, and the performance expectation is mastery when we're looking at the scoring. And then the other thing that you'll see in the literature is when we're looking at scoring and talking about transparency is use rubrics and then make that transparent to the students so that they know what's going to be evaluated for them. Next slide, please. So when we are looking at authentic assessments in nursing education, there are some critical elements that you want to look at to determine authenticity. Does the assessment activity challenge the student? Because we do want to challenge our students, because look at the real world context of what's going on right now. So we want them to think outside of the box and to transfer the knowledge that we've given them via didactic content to the real world. Look, we're in the middle of a pandemic. We're getting ready for a twin pandemic because flu season is coming as well. But we're graduating nurses, or for those of you that are our clinical practice partners, you're getting those nurses now. I'm hoping that we're giving you nurses that will take the knowledge that they've gotten in our programs and can transfer that knowledge and use it in real world context and pivot pretty fast to deal with real world complications. So for example, our students that graduated before the pandemic, you know, they were just coming off orientation, they were doing their residencies, and all of a sudden they're now working on the floors or in the units or out in the community, and COVID hits. And so we're getting feedback that they felt prepared, and they felt prepared because they felt that we had done more than just test knowledge by multiple choice questions. We've used simulation, we've used portfolios, we've used case studies to get them to pivot pretty fast in real world, what's going on in the real world. So number one, does the assessment activity challenge the students? Number two, does the final assessment outcome require a performance or product? It should. So that product could be a portfolio, it could be the answers to a case study, or the outcome is competency or mastery. Number three, another critical element, does the assessment activity require a skill demonstration that indicates transference of learning? So you want to see if you're doing that, if we're not using paper pencil tests, or again, multiple choice testing. Think about, wait, is this a skill that's going to demonstrate something that they can use in the real world? Because that's what our clinical practice partners want. Number four, does the assessment activity require demonstration of metacognition? Do we want them to use higher level learning skills, you know, thinking skills? And for most of us, I think we would say yes. Number five, will the final product or performance be recognized as authentic by those in the workplace? If we're using simulation, are we using things that the students are going to see in the workplace? And would our partners say that yes, that is true, and that will help transfer their knowledge? Six, are the assessment tools actual or simulated? And is fidelity required? And for those of you that use simulation, you know there are different levels of simulation ranging from low fidelity to high fidelity. So you can make it simple when we think simulation. Don't get overwhelmed thinking you have to be in a simulation lab. You can use some low fidelity simulation techniques as well. Number 7, is a student discussion and feedback required as part of the assessment? I personally think student discussion should be, and their feedback is required to make sure that that is authentic. And then also for that experience, we want to get to the fact, not so much use it always as a teaching moment, as we know in simulation, but to talk through the student feelings. So for example, if you have a simulation activity, and let's say it's giving a medication or it's hanging a blood product, and that error is made in simulation, which is where we want the error to be made, right? We don't want it to be made at the bedside with real patients. Well, students are going to take that to heart and actually be upset about it probably when they realize that that could have contributed to a patient error. And so they need to be able to debrief and to talk about it. Number 8, is student collaboration required as part of the assessment? If you look at some of the literature, they think that students should have a say in that, or if you can include them, that would be helpful. Next slide, please. This is such a busy slide, and I'm not going to read this slide to you, but you can get this from the Poindexter article. And you'll see that the Dr. Poindexter and her colleagues, they surveyed the literature and they pulled together from the literature for the table that you see in front of you. And the original authors that are included for the information that's in this table, all of those can be found for the full references in the Poindexter. But if you are confused about what's a traditional assessment versus authentic, you can just go through the table that they have listed. You know, for example, the purpose, as far as a traditional assessment, that's assessing the student learning about very specific concepts, okay? Whereas authentic, that's the readiness we're looking at for after graduation, and more than just pencil, paper, or computerized testing. We want to prepare our graduates for the real world, or for our practice partners. Once you get our graduates and you have them in residency and their preceptorships, you want to give them and test them, not just by multiple choice tests by traditional assessments, but also expose them to what they're going to see on the floor and develop their critical thinking skills for real world situations. So this is a very, the table is very small, the writing's very small here, but if you go to the Poindexter article, you'll see that there is a link and it will pull up to a Microsoft document with this information on it. Next slide, please. So again, Poindexter culled the literature and they came up with these ideas for that they've identified as authentic assessment strategies. So we want to apply authentic assessment to clinical education that requires students to demonstrate their competence to think, to decide, to act in the real clinical world. So some of the strategies they can use, and we're going to do a deeper dive about these in just a little bit, are portfolios, using standardized patients, using OSCEs, so these are the objective structured clinical examinations, having students work on concept maps, videotape scenarios, case studies, maybe some self-assessment, continued education, because a part of authentic assessment is continued thinking about your own lifelong learning to make sure that you're staying competent as well. It could include peer review, especially with assessments. Maybe your students are in a writing course, and so peer review can help if they exchange their papers, so they have peer review before it comes to you. Direct observation, interviews, measurement of patient outcomes, simulations, all of those are what we consider authentic assessments. And I bet some of you are surprised because I bet many of you are doing this already and you didn't know what to call it. And so they're called authentic assessments, and they differ from the traditional assessments where we think of the usual multiple choice questions that will make students successful for when they're taking their licensure exams or the certification exams. But remember, those don't test competency. You know, when you're taking your licensure exams, they're only testing knowledge, not competency for the most part. Maybe just a slight competency by for example, if they use hotspots. But that's not true competency. So how can we get to the competencies and masteries? It's by using these authentic assessments. Next slide, please. So how about portfolios? So nursing portfolio, that's a collection of documents that demonstrate professional goals, accomplishments, competencies, and skills. And there are vendors out there that your nursing students can develop electronic e-portfolios with, or they can just make the hard file copies like this. So with the portfolios, you know, it would show, it would have the resumes in it, it would have any certifications, any certificates that they've gotten, and it would have any, if they've had courses, and then you've required that they had to write papers for it, or if they've gotten to publish any articles based on those papers, they can build that into their portfolios. And that's really nice for when they go to show their employers, to show, wait, I'm more than just this resume, or this 2-page resume, or this 3 or 4-page CV. This is actually, you know, what I have done. And you can do it via a hard copy like this, or electronic portfolios. And we tend to use these electronic portfolios at the graduate level. Next slide, please. How about standardized patients? So it's a form of simulation, you know, when you're using these standardized patients. They've been used in medical education for decades, but their use in nursing education is more recent. And the research has shown that using standardized patients can decrease students' anxiety and enhance their critical thinking and communication skills. So I know for us at GW Nursing, and many of my colleagues that use standardized patients, they tend to be actors. We use actors. They follow the script. They don't deviate from the script. And sometimes they're part of the debriefing process with the students, because students are nervous with the standardized patients when they first start. And so I kind of like it when they're part of the debriefing process, because they can turn to the students and let them know, listen, I really liked how you looked me in the eye. And when you were taking my history, you got down to my level and you sat at the chair and you weren't just charting on the computer. But this is things I think that I would have appreciated more if you had done, because I gave you a scenario and you only heard part of it. So it's nice when they're part of the debriefing. They don't talk, they act, they stay within their role when the student's being evaluated for the performance for the patient. But afterwards, it's nice when they're part of the debriefing. So we also use the standardized patients for example, for our interprofessional education days. So GW Nursing, we're a part of academic practice partnerships. We have we're affiliated with an academic medical center, as many of you are. And so think about with interprofessional education, we have different scenarios. For example, we're getting ready to have an IPE event next week, and we'll have standardized patients. So they're actors, they're following the script, and they'll come in and they're playing a role, and the students can ask them questions, and they are going to answer those questions according to the script. And then the students will take a history and write a history, you know, for them. But because we have to run so many rooms, we have to use probably about 10 or 11 actors, and they all have the same script. And then we just have to write the script so that they can pivot on whether it's a female patient versus a male patient. And these actors are good. They've studied and they know what the potential questions could be. And if not, they're pretty good at answering or getting to what we're trying to get to for the patient and have to pivot. Okay, next slide, please. How about OSCEs? if you have a simulation lab, you probably have access, a way to do the objective structured clinical examinations, OSCEs. If you don't have a simulation lab, there are other ways you can do it via two-way mirrors. This is just a picture of our OSCE lab at GW Nursing. So we took our the school that I teach at George Washington University. The main campus is in Washington, D.C., but our second campus is out in Ashburn, Virginia, out by Dulles Airport. And that's where we have our undergraduate program, our accelerated degree program. And our graduate program, most of the didactic content is online. So most of our students are throughout the country, just like, University of Phoenix is and others. And so, but they do have to come, our students, especially if they're getting a nurse practitioner degree, they still have to demonstrate their skills and their competencies. They have to come to Ashburn, Virginia for a couple of times during the program so we can test out their skills. Didactic knowledge, fine. We have proctored software, we give them exams, and that tests their knowledge, but not their competency. So we built on the third floor of our School of Nursing, we built what we call our OSCE labs and the simulation labs. And so you're looking down the main corridor here, and to the right are computer stations and then exam rooms down for about 5 or 6 exam rooms. And on the other side of the hallway that you can't see, that's where the nurse would enter, where the patient would be waiting in this room. It's a two-way mirror. So the instructors are listening, they're on the computers you can see in the hallway, and they have their headphones on, and students know what the rubric is, they know what they're getting tested on, and then they're recorded, and then our instructors are also watching and looking at that. So the instructors are not in the room, but they are watching this. We did have to pivot towards to do a virtual version of this for when COVID first started, and then we'll be back into the labs for testing out later. Next slide, please. Concept maps. We use concept maps at the undergraduate level a lot. And their drawings or diagrams, they're used to help students organize and represent their knowledge of a subject. They begin with the main concept, so that starts in the middle, and then they'll branch out to show how that main idea can be broken down into specific topics. And so sometimes students struggle with 20 or 30 pages of notes that they've been taking in class, or they're following the PowerPoint slides that we've provided for them. And they still can't, they memorize that content, and they still don't do well on tests. So we found concept maps. Students actually gravitate towards this because if they can see it on paper, write it all out, make the connections, then it kind of solidifies the concept that we're trying to get across to them. So this is an option for an authentic assessment that you can try. Next slide, please. Case studies. The case study is an effective clinical teaching strategy that's used to facilitate learning, improve critical thinking, and enhance decision-making. So one way that we use our case studies is, I'll explain what we're doing now at GW Nursing. The students get their didactic content online. So they go for 2 hours online, they watch recorded videos. Then they join us the next day for some synchronous work where we do a whole bunch of clicker questions, and then that can download to our learning management system. But then we'll end the day with some case study work, and we'll present a case study. For example, I taught yesterday, and our content for the first semester students in Med-Surg was GI. It was gastrointestinal. And so we went through, they had to watch the recorded videos, just taking them through all the GI content, didactic content. Then we meet for the synchronous content. We have clicker questions to make sure they watched the videos, did the homework, can answer typical like questions, more than remembering and understanding, but also application and evaluation. And so Then we ended, we let them go on a break after about an hour of the clicker questions. Then we came back and we explained the case study. And it was about a patient that was having an esophageal bleed. And we had 6 questions. And so we told the students, this is our case study. It was about 3 slides long. And then we ended with 6 questions. And so we said, okay, we're going to put you into 6 groups. And group 1, you're going to answer the first question for the case study. Group 2, you've got the second question. Like group 1, it's what's the SBAR that you're going to report, the situation background assessment and the recommendation when you have to call your healthcare provider. You're going to tell us what that would be. You know, very simple SBAR report. Group 2, what do you think's going on? You know, et cetera. So we had 6 questions, put them into 6 groups. Then we can break them out into their 6 groups. And then my colleague and I go to visit the groups to make sure that they're on point. I will tell you a little trick. We tell the students, because we're in the synchronous mode right now, we do tell them, don't leave for the case studies, because sometimes you kind of lose your students. They go, oh, it's a case study. Sometimes they don't see the value of the case study approach, that what you're trying to get at for them. So that's why we try to be transparent. So I always add some clicker questions at the end of the lecture, because I tell them, hey, you're going to do the case study now. You have about 10, 15 minutes to work on it. My colleague and I are going to come visit you, and I need someone from your group to report out to the class for the case study. And then I tell the class, everything that's discussed, what your colleagues are presenting, is fair game for your next exam. So I would encourage you to stay here in the class, contribute to the case studies, and then we're going to end the day with some clicker questions, because the clicker questions are tied to Blackboard, to their learning management system in their grade, and then you don't lose students sometimes if it's tied to a grade. So I was really impressed when we did the GI case study and the students reported out. And the reason that I go to visit, my colleague to go to visit, I went to visit groups 1 through 3, and she went through 4 through 6, because I make sure that they're on task, on target, reporting correct information. They'll tell me what they're going to do, what they're going to present, and then I'll just correct or add, or at first when they want to call the provider for the SBAR, they want to give this whole history, and we have to say, hey, short, simple, this is the SBAR format, and I'll help them with that. So it really gets to their critical thinking skills. And then when we bring them back into the classroom, they will report out. And then I'll tell them afterwards, if, group 1, can you put in the chat box? Because this is now, this is the world that we're dealing with the virtual environment. Please put in the chat box your answers so that your colleagues have it. And then they can just copy and paste that for when they're studying. Next slide, please. Simulations, you don't have to have this awesome simulation lab, although I know many of us across the country, do have simulation labs. Anything that requires a student to interact outside of a testing environment, paper, pencil, computerized testing is simulation, anywhere from low fidelity to high fidelity. Low fidelity would be some role playing, like the students, role play between each other, like one will be the patient and one will not. And you don't need fancy equipment, to be doing that. So with simulation, nurses can hone their abilities and skills and commit every possible error without harming real patients. We want them to make the errors in simulation and not in real life with the patient. Next slide, please. Okay, so just wrapping up with what we're talking about today. Authentic assessments, they do have several advantages over the conventional tests. This is coming from a different resource, and that's down at the bottom of your screen from the Center for Innovative Teaching and Learning. So they say that the differences between this and conventional tests, they're likely to be more valid than conventional, particularly for learning outcomes that require higher order learning skills. Because they involve real world tasks, they're also likely to be more interesting for students and thus more motivating. They can provide more specific and usable information about what students have succeeded in learning, as well as what they have learned. But authentic assessments may require more time and effort on an instructor's part to develop. They might be more difficult to grade. They do take time. And then remember the previous slides that I showed you. When you're thinking about authentic assessments, you have to think about those overall concepts and what you're getting at, and if you're going to involve your students. To address the difficulty of grading authentic assessments, it's often useful to create the grading rubric, which we've also discussed. And that specifies the traits that they're going to be evaluated on and the criteria in which they will be judged. And in fairness to your students, you should share that rubric with them and be transparent about that. Next slide, please. There are a number of web-based tools. They're well suited to support authentic assessments for students. They can do video clips. There are links for resources, some images. They can even do gaming. Gaming's kind of fun. Before we had COVID, it was fun to go to conferences and learn how people were doing escape rooms. And students really like that. And there are ways you can do virtual escape rooms as well. So think about that. This is a picture from the University of Buffalo, where they were using an escape room for an interdisciplinary activity between nursing students and the pharmacy students. And they had to work together as a team to save that patient and give the right medications. And then Western Governors University, they've got one that's out now that's a virtual version, and students love it. But you have to have a really good technology department to help you build the virtual versions, because they are time consuming. All can be used to preserve much of the situational complexity the students will encounter in practice. Next slide, please. When you're using authentic assessments, don't be afraid to use technology. So you've got these great communication tools like your discussion forums, webinars, group meeting software, so that the students can communicate with each other. Like I said to you today, you know, we use our learning management system. It has software so that they can collaborate within the classroom, go into breakout rooms, then come back and report to the class, both verbally and using the chat box. E-portfolios are available to you. Reflective journaling is a part of that's a type of authentic assessment that I really didn't allude to, but that will get there as well. Authentic assessments of student skills can be used in publishing and presentation software. You can find that as well to disseminate project outcomes, because the students can submit presentation abstracts to their peers, and then they can get feedback for that and participate in an online peer review process. Next slide, please. Conclusion, the demonstration of skills beyond those limited to curricular content. It's an inherent element of authentic assessment. You just don't want the students to know just know the content when they graduate. Rather, we want them to be able to use the KSAs in the real world. So our assessments have to tell us the students can apply what they've learned in those authentic assessments. And educators can use all of this information to assess student thinking and action, clinical reasoning, complex decision-making, and the reflective skills. Next slide, please. So I have a question for you, and this is the third objective that we had for this presentation today. So if you can use your chat box, tell me how you think students can personally benefit from this type of assessment. Feel free to use the chat box, and then I can read those off. But how do you think students can personally benefit from this type of assessment? I see people have used concept maps. Hey, good morning to my colleagues in the Philippines there. So yes, more realistic feedback. It is a safe space. Thank you so much for bringing that up. Enhanced learning, centered, it cements their learning. They value what they'll see in the real world, and they can realize their strengths and weaknesses. I agree with you. It will provide really thorough information, for them. So I think you've hit the nail on the head. And I like that idea about a safe space. And we have, as instructors, have to support that for them. Yep, authentic assessments, they allow the students to reflect on their own competencies. It's more motivating for the students. It's very engaging. By using their own words, they're more able to synthesize content and skills. I love your feedback. This is perfect. This is better than if I came up with stuff on my own. It's a collaborative process, exactly. You provide that safe environment, they feel comfortable in asking questions, and we want them to make the mistakes in simulation, versus the real world. Susan says she's a clinical educator in acute care hospital. They seem more prepared at the bedside for the first few weeks, so that's great. And yes, Graciela, you're saying that it's a formative process, versus multiple choice tests, which is at the end of the program and summative. Abby says when students feel safe, they're more likely to focus on the outcome rather than their own self and their own anxiety of fears, and allows students to demonstrate and have a sense of ownership. And and Rochelle, it's hands-on learning versus tests. And great, I like this last one. That's a good segue. Hoping to become a member of Sigma. We want you. So I'm gonna go ahead. We're getting towards the end. If you have any questions, just in the interest of time, feel free to email me. You can find me. I'm at George Washington University Nursing. There's a way you can look up my name, and I'm happy to answer any questions for you. But I'd like to turn it back to the group as we close out, because I think there are some closing remarks for you. And thank you for all your participation. Thank you for inviting me to be with you tonight. I can't believe I'm a part of 3 chapters here, and I miss my colleagues in the Philippines. Here's a shout out to my colleagues in the Philippines. I miss you. I got to be with them and got to meet them in person about 1.5 years ago. So thank you again for having me tonight.
Thank you so much, Dr. Cox, for sharing your work with us and for allowing participants the opportunity to provide some comments to share with some of the ideas that they're seeing put into practice. To follow on to the comment about hoping to be a member of Sigma, and to you also, Dr. Cox, you're welcome to come to Phi Gamma. We have lots of openings and would love to have you. Those of you that are legally recognized to practice nursing, have a minimum of a baccalaureate degree, and have demonstrated accomplishment in nursing are more than welcome in Phi Gamma, as we take only nurse leaders. If you'd like to be considered for membership, please go to the sigmanursing.org membership page. There's a nurse leader application that's posted there. If there's not a chapter nearby you, please indicate your interest in Phi Gamma, in Omicron Delta, or Nu Xi at large. However, if you're currently a member of Sigma and would like to transfer to or become a multiple member of one of our chapters, all you have to do is contact Member Services, MEM-SERV, at sigmanursing.org or through the call center, and they will help you to accomplish that activity. Again, thank you all for your attention. The link to the evaluation form will be posted in approximately 1 week on the Circle discussion boards to be completed and submitted online. Those who complete the evaluation process will receive a certificate within about 90 days. The presentation has been recorded and will be open for viewing for 30 days. If there are others that you think would like to review the presentation, please feel free to direct them to the link, which will also be posted on the chapter and regional websites. Again, I would like to thank Dr. Cox and the sponsors and program committee for making today's continuing education offering possible, and Dr. Ricciardi for joining us for this inaugural collaborative presentation. And most especially to thank you, colleagues, for your attention. Have a wonderful rest of the day or evening wherever you are in the world. The session will now be ended. Thank you.